This video demonstrates a 2-hour massage with medium pressure that has focus on the back and right knee. Though it is enough time to massage with subtle added time to the right knee compared to the left knee. After the massage, our client felt wonderful. Our family dog, Princess, was along for the massage.
We start the massage with eucalyptus aromatherapy. We rub it together to get the scent, and we rub our hands under the face cradle where the client's face is so she can inhale it, and that's very therapeutic. We then distribute using effleurage, flat palm, finger fat pads together across the back to distribute the oil and lotion across client's back. And we tuck the sheet further into her sides to not expose her buttock region. We continue the effleurage with the flat hand palm driving into the deep layers of the back, and we use thumb stripping. And I'm just doing a thumb stripping to scan the areas. I usually start in the upper back, going to the mid back, and going down to the lower back right there, just along the rector spinal muscles. And so we got the paraspinal muscles. We're just going to do strip by strip, 3 to 4 per strip. You can go center to outer, outer to inner, center, outer, inner. Whatever your flow is, just make it relaxing. So you use the long thumb stripping with your finger fat pads, of course. You don't want to just jam your thumb bony side into the skin because it can be unnerving and uncomfortable and definitely not relaxing. You do want to use longer strokes to massage your clients so they enter a restful, peaceful state. And with that, I do the thumb stripping with my thumb fat pads. The fingers that are spread out like that are just for guiding the thumb along in that straight path, but you can have your thumbs working the same with knuckles. You can make your fist knuckles going in a straight line path. You're just going along the deeper muscle layers. Along the paraspinal, you have the top layer, which is the trapezius and the QLs, depending on which part of the back you're going down to. This area is the QLs. Deeper to the QLs are the psoas. And you also have the rector spinae muscles that are in between the QLs, so that they are right next to the spine. And so there's about 3 layers in the lower back, at least 4 though, because you have your direct semispinalis and other muscles. Just want to do a relaxing massage over those muscles so you can scan for tension, changes in soft tissue texture. Look for those knots and then gradually build up into those knots and that tension to relax it away. And you're going to do that with constant massage. You choose your tool. You can do solid firm palm effleurage, finger fat pad effleurage, thumb stripping, a deeper firm hand surface for a broader area to reach the sensory of the soft tissues. Move around, glide, keep your contact the whole time and your rhythm, going the same speed. If you want to do an energizing massage, you can go faster. We've now switched from going top down to low back to upper back. I'm just rubbing around. I'm kneading actually. You probably can't tell that, but I just take the top layers of tissue just to get some blood circulation and gently knead it just like dough, just so those little molecules can run into each other and help relax the tissue from the top layer to the deepest layers. Tension builds up in people who don't get good circulation. They're stuck and confined in seated positions or standing positions all day. It really puts a toll on the body, the blood circulation, the high stress, the increased hypertension that many people get, the diets, the lack of emptying their bladder occasionally, all the coffee, the sweets, poor choices for diet, studying, stress, having to memorize, eating more than you need. Some people binge drinking on their days off. All of that added stress adds to all the tension in their body. Your body holds on to all of that tension, and it's felt in between the muscle layers. You have the muscle layers, you also have the myofascial that covers each muscle. And so you have layers of soft tissue that includes the skin, the fat adipose layer. It also includes the fascial layer that connects many muscles of the back, such as the iliothoracic, iliolumbar fascial, the fascial around the ribs, fascial around the spine. All of this interconnected. You can get adhesion lesions, which are little micro tears that turn into adhesion lesion knots. That's what a knot is. It's from the natural ability to heal and repair. So you're going to heal and repair each of these knots. You're breaking it down. You can notice the tissue gliding easily. There's a tense spot right there at the top. I keep going to it because it is a more tense spot than normal, and she does have back pain. She says she often gets low back pain, and in that area it could be due to stress. This can be due to female reproductive symptoms of polycystic ovarian syndrome, uterine fibroid, menstruation, anything related to the female reproductive cycle in the female. Also can be from ureter pain due to kidney stones. It could be from referred pain from the gastrointestinal tract, and due to constipation, if it's backed up, it pushes on the lower back. So anything just like when I'm pushing with my fist, it's pushing stuff around. It doesn't disappear. So it's going to push everything around, and it's going to go around in the abdominal cavity, thoracic cavity, because you have the spinal column. It's got its myofascial. It has all of the muscles and their myofascial interconnected, supporting the structure, the bony structure for posture, and supporting the organs and protecting them. But then you also have the peritoneal cavity. You have the aorta and the vena cava. The aorta supplies blood to the body, periphery, from the heart, and the vena cava empties out the used up blood from the periphery to the heart to clean out with the lungs. All of that is anterior to the spinal column, which means it's in front, slightly lateral to it. And then you have the bowels. The bowels, you can actually feel pain in the lower back right around that region. The kidneys are right above that region. Her waistline is higher. Her hips are actually lower than the sheet. But what that region is right there, right where I started with the thumb right there, that's the thoracic lumbar region, and that's where the kidneys are bilaterally. If you have pain right there, that could mean you have possibly a kidney stone, possibly inflammation, something with the stretch receptors, although there are some conditions where the kidneys can get very large, and it's called polycystic kidney disease, and they can weigh like 2 pounds each, and the person feels no pain because of the reaction that they have. That is a genetic condition. There is nothing that typically causes it other than it just being a congenital birth condition, inherited. It's not X-linked either. And so here we go. We're massaging. We see some circulation increasing. You can see the redness and the pinkness. The client is relaxing. Going right along the spinous processes where the paraspinals are. We're in the sinus spinalis region, thoracic, lumbar, and so on. You get the idea. Thumb stripping. Keep thumb stripping with the fingers. Moving down, superior to inferior along the spine, paraspinal. You never want to go deep over any bones. If you feel ribs, lighten up because there's no tissue. There might be sensory there. And if they do take opioids, from experience, I have almost 20 years of the massage experience, and very few clients don't like my pressure. And if they do like deep pressure, I know the spots to make them not want the deep pressure the next visit. People that don't feel the pressure, they have blockage. They don't have good circulation, and they're usually on a brain controlling pain inhibitor. So they're not going to feel anything. They might feel a little bit of pressure, but that's it. So if they're on opioids or high brain stimulants that are blocking the pain, they're not going to feel the pressure. And also those with metabolic disease and endocrine disorders can possibly have a higher tolerance for pain, but it doesn't mean they're healthy. Doesn't mean they're strong. It just means that their body is not responding to circulation and healing like it should because they're blocking out the pain sensory. And that is part of the healing process. You have to have a little, whenever you get injured, you have to have a little bit of swelling called inflammation or douleur. two more, or then you have to go dolor, which is the pain, and then you have, which is if they don't feel it, they're not healing properly because they're inhibiting it from the brain. You also have to have redness, which is rubor, and then you have to have puncio de laiso, or loss of function temporarily, just to protect the tendons and the muscle fibers as they heal. So it's actually just, and then also calor, which is heat. You have to have heat, blood going to the region, because it's providing all the macrophages and monocytes and pro-inflammatory factors that protect the area while it builds and repairs the damaged tissue. Then after that state, which is the acute state of healing, those are the 5 cardinal signs of inflammation. Then you enter into, with some time, the redness goes down, the heat goes down, the swelling goes down, the pain goes down, the loss of function is limited to not there anymore. And then that's the subacute phase. And then you can start to notice that the healing has allowed more relief. They might be more ready to pick up sensories. Their nerve fibers aren't crossed. They don't have allodynia. They're not picking up itch or tickle or any other sensation, like a pinpoint prick, or like something you wouldn't do, like acupuncture uses that. But those are necessary stimuli that are noxious stimuli, also chemical stimuli, and temperature. Pain can be blocked by those, and inhibited by it. Those can be inhibitory factors to pain. Also, the fastest way to inhibit pain is having your client actively do a muscle contraction to work that muscle along that nerve root where the pain is. Doing repetitive motions like that, they train the brain, they give it neuroplasticity, they rebuild the sensory nerves, and they prune the old sensory nerves that were really faulty and not accurate, so that you can retrain with neuroplasticity, growing your peripheral nerves using the Schwann cells, where they are in the periphery, and oligodendrocytes in the central nervous system. But the pain will be inhibited. It goes on a faster nerve fiber, which is called, if you're going to be using the muscle spindles, 1A, and the 1 gamma cells for the Golgi tendon organs that are in the tendons. Now, the muscle spindles, they prevent overstretch of muscles. The Golgi tendon organs prevent overcontraction or overloading your muscles before it gives out and breaks and tears or ruptures the tendon from the bone attachment. Now, that is one classification. That is the classification of the lower LOHR. There's that uses type 1 through type 4 nerve classification, where type 1 is the faster and type 4 is the slower. Different, it's not really a trade-off from one to the other, because they have different ways of evaluating the size diameter, which is different than the other classification, which is used more often in the chiropractic school I went to. They use the Erlanger Kasser, or it's Erlander Gasser, so one of those. Anyway, that uses the alpha. So you have the A alpha, you have the A beta, and then the type 1A and gamma are in the alpha for that. And those are the fastest, thickest in diameter, and most myelinated, so that they travel faster. And that is the mechanoreceptors and proprioception. So those are going to go faster than what the A delta, which are slightly smaller, and those are for acute pain fibers. The acute pain fibers for the A delta, they carry pain and temperature, usually cold temperature, and it also has a little bit of light touch. Now then, if you want to use the slowest nerve fibers for pain, that's the chronic pain. That's the same pain that people take opioids for, and they can't feel any pressure you add, and you know they're not lying because there's no circulation under the area that you're literally putting all your body weight with your elbow tip onto the point, and they're not feeling it because they're on opioids. or they also have chronic pain and they only feel the pressure, and so the chronic pain is being doled out essentially in their brain by the opioids. And you won't have a good massage outcome if you're on opioids. It's not going to ever be good. It's going to make you very upset too. So I recommend, if you're going to do massage, do not take opioids. Do not take another painkiller, because you will not benefit from the effects of massage therapy. Massage therapy works on those nerve fibers to inhibit pain in the acute or chronic, which is the C fibers of the Erlander Gasser system or Kasser system. And C fibers, it's only for pain, it's only for chronic pain. And those fibers also work with the autonomic nervous system, so they can work on the sympathetic and parasympathetic. Same with the A delta, and the B fibers are for also the parasympathetic nervous system. C fibers for chronic pain, they also transmit heat. So they might feel really hot, and actually if they have chronic pain, it's a sign of complex regional pain syndrome, which is a cortical-based brain processing of pain, where the nerve fibers, like the noxious fibers, and the pain fibers are crossed. So what you have is you have little nerve fibers that are growing into the noxious nerve fibers for like tickle, itch, and pressure, that are sending pain every time something light touches the skin, or even light pressure. And that's not normal. That's seen in chronic pain patterns. And those people, they also tend to have redness and heat in the area as well. So that's why C fibers also transmit heat and pain. So as you can see from her body, she's healthy. She's 20 years old. She's a student. She's getting some good circulation. And we're not doing deep tissue. We're only doing like a medium tissue. A medium pressure. Right now, I like to work on the back and then move to the hands, to the arms, going down. You start top to bottom, moving up to the shoulders, to the arms. Lightly massage the arms, because they can be very sensitive, because they're that's where a lot of the heavy arterial and venous supplies to the arm, to lower arm or to the forearm and the hand. So it can be sensitive, and it tends to be a little bit more layered with adipose tissue. Unless they use their arms all the time and they complain of arm pain, you really don't need to add more than like light medium pressure to the arms. And it's good for stimulating and moving around circulation to get to where you want to go, where it's going to be more dense on the forearms. I work with my hands, so my forearms are pretty thick, so I like to dig deeply into people's forearms, because I know as a student as well, that also contributed to tight forearm flexors and extensors from typing and writing notes. And sometimes that's not the case, so they might just have tight forearm flexors and extensors, and it could actually hurt them. But always just check in with your client and let them know you're there for them and you don't want to cause them pain. And then if it does hurt, to tell you, hey, that hurts, can you go a little lighter? And then if they don't feel it, tell you, hey, can you add a little bit more pressure? I'm not really feeling it. Yeah, don't be offended if they don't feel it, because some people, you are adding a lot of pressure and they still can't feel it, because there's something else going on in their brain. It could be opioids, it could be stress, it could just be that they're really occupied in their brain, their prefrontal cortex, that they're angry, they might have had a bad experience with somebody else, like the front desk, or wanting to end the membership but being forced to get a massage or whatever. I don't know. I've worked in many franchise locations that tends to be the case. So here we go, and you don't really have that many clients like that. They're like 2%. There's not that many. But most people are thankful that they're getting a massage and they enjoy the wellness benefits. Don't let them people burn you out. So as you provide your healing services, you reflect on the benefits that you can cause. A generally healthy person that can tolerate massage, because not every person can handle massage, or they have their own mindset on massage, so they just can't anyways for other reasons. But it is a good way to add to your wellness goals. It helps detox the body. It's eliminating tension and compression of peripheral nerves. You're scanning the area right now. I'm actually thumb stripping, but my fingers are also scanning the top, because you're covering a broader surface. You can also use your knuckles. Thumb stripping again. These are my basic go-to moves. You really don't need to do anything fancy. There's nothing really gonna change about that. As long as you're finding the knots, you're relaxed, you're letting them know you're there for them. You don't want to cause them pain. You want to get rid of their pain. You're gonna find those knots, that tension. You're gonna help relax it. You're gonna break apart those adhesion lesions. You're gonna free up space for the peripheral nerves, for the vasculature too, for the lymphatics. So they're detoxing. So you're gonna have little tiny old adhesion lesion knots break apart, go into the circulation. You're gonna see the signs of healing from the chronic injuries, because they are injuries, mild injuries, which is just tension built up in the soft tissues. You're gonna see redness. You're gonna have a little bit of heat circulation, possibly. They could feel sore the next day, depending on how deep the pressure is. That really dictates if they're used to it or not, when they're gonna feel pain, if they're gonna feel pain at all or not. Like somebody who works out all the time and has hardly any body fat and doesn't really have any aches, and they're just getting a massage for the first time because they're there because their mom or their girlfriend sent them, or other way around. It's usually the guys that work out too much. Occasionally females too work out too much, but they'll tell you like, hey, my body's already breaking down the muscle fibers. I don't think it wants any more of that, because they will be more sensitive to massage. So you don't want to go deeper on people that worked out really heavy, have already broken down muscles in that region, because it's not good for everyone. You have to understand that people are different. They're not the same. Even body size is not the same. So they have different things going on in their brain for processing different sensory throughout their body. What you can provide is pressure. You can use the tools not to hurt them, of your thumb fat pads, finger fat pads, knuckle fat pads, elbow, forearm fat pads, all this to break down those tension tight spots. If they don't have any pain and they're just there to relax, then just use firm, flat palm, drive the palm in, guide with your fat pads of your fingers, or use thumb stripping lightning. Find little tiny micro knots on the superficial layers. You don't really need to go that deep into them. Or just work on other areas, because many people don't know that they have aches in their body until you get to them. But you really don't want to dig deeply into it, because you're there for them to relax and be in a restful state for detox, healing, and distressing, so they can live a longer, high-quality life. I had to bring my dog in right then. That was Princess. She was whining. The big dogs, you know, she likes to be where all the people are, so. Princess is there. She's familiar with our social media model. And so she's actually going to be there the rest of the massage. This is fine. She's okay with it. I mean, typically you do want to have your 2 hours, your hour, your 90-minute massage distraction free. But we took it to my place, and this is one of the reasons I don't massage people at my place. But this is just for marketing, social media, and to educate you all about massage and the healing benefit. And a 2-hour massage, you could typically spend about 45 minutes on the back, maybe, 15 minutes on the arms. Before I turn people over, I probably, in a 2-hour massage, I'll massage with the person face down for 90 minutes. But beware, some people, I'd say like maybe 30% of them, if they're face down with their face planted on the face cradle, for longer than an hour, their sinuses get congested and they get uncomfortable and they can't breathe. It could be less than that, but lately I've been seeing a lot more of that. Before, it was a lot less people had that problem. And some people have injuries, so you might have to find ways to massage them face up the whole time, or sideways. Sideways, you can also get into the muscles. Some of the muscles you can't even get to when they're face down, as well as like a little bit of the adductors of the thighs, or the abductors of the thighs as well. And then on the legs, probably you can, depending on what they do for work, if they have sciatic pain and ischemia patterns of muscle dually aching pain from the shooting nerve pain firm sciatic type impingement of the sciatic nerve as it travels down the leg. You might spend more time on their legs. You can spend like 20 minutes on each leg just getting all the thigh muscle, getting the calf muscles, turning their leg to get the IT band, or getting the peroneus longus brevis, the tibialis anterior. The thigh muscles, you can get the semitendinosus, semimembranosus, biceps femoris, work on each band of the hamstrings into the IT band. You can get some of the vastus lateralis while they're prone too, or face down. Or just relaxing long strips, look for tension, adhesions, changes in soft tissue that maybe you can make it more like the other tissue and flatten it out, just make it all consistent. If they spasm or react, go later. If they're not feeling anything or reacting, they're not asleep, then add more pressure. And then circulate with kneading, petrissage, knead. And you just do this 3 to 4 strokes. You could do like 6 to 12 strokes. Little strips of each muscle fiber, just moving from attachment to attachment as close as you can. Insertion from origin, insertion to origin, origin to insertion, however you like, cross fiber if you want. All of this is good for the muscle fibers and soft tissue because it breaks apart adhesion lesions and it brings in circulation. And then it's going to free up room for the nerves, the peripheral nerves that travel through. In the form right here, that's the anatomical hand up, but she's face down. So we're looking at the median nerve that supplies the thumb and the index finger, and it goes down to the wrist in the middle before it splits. The ulnar nerve is on the pinky side. That supplies the pinky and the ring finger and half of the middle finger. The median nerve also supplies half of the other side of their middle finger. The radial nerve is in the back, and that's on the back of her triceps. It comes out from where the arm meets the back, right there by the armpit. And it's called, it's like right between the teres major, I believe, and minor. That's where it goes. And it comes posteriorly through the triceps major, the long head of the triceps muscle, and then the medial head down to that part of the elbow on the other side, though, as it wraps around to the back of the hand, because our client's hand is turned palm down if she was face up, but we're seeing the palm up because she's face down. And so be aware of that when you know what nerves you're looking at. We're into the pronator teres, and we're into the cubital tunnel. We're relieving tension around the cubital tunnel where the ulnar nerve travels down to supply the pinky and the ring finger. Now we're moving more towards the... Okay, so I'm going to tell you the thumb side's called the lateral side, even though it's medial. So we're moving more towards the lateral side earlier now. To the medial is the pinky, because in anatomic position, the palm is face up like the face, so because the palm's face up while the face is down. That's not anatomical position, but you have to be aware of that. Because when it comes to directional movement and location on the body, it's always relative to the anatomical position. And the body can change, but as long as you know where that is in the anatomical plane, you know what direction you're going, what nerve lays there, what geography is there of the body, the anatomy of the body, so to speak. So, massaging the arm, just doing some petrissage right now. You can find knots in the arms closer to the attachment sites, more so, but the tendons of the muscles are longer. There's actually 3 layers of muscles in the flexor tendons and the extensor tendon. You got your superficial, you got your intermediate, and you got your deep muscles. You got the, I don't remember them on my hand, so I'm just going to be honest to you right now. We just call them the flexor tendon and the extensor tendon. Supinator is on the radial side, so if you get impingement on the supinator, that's what turns your thumbs out to in when you're in the anatomical position. And then when you're in the palm up, the pronators are right where that butterfly is right there. The pronator tear its head, so those are going to pronate the hand, so that if you were anatomical and the thumbs were outside with palms up, that would be turning your thumbs inward. No, oh, I confused myself. So yeah, pronation, thumbs are out and you turn them in. Supination, thumbs are already out from your anatomical and you just turn them out even more. And that's supination. All right, yeah. So we're finding a nice rhythm. You see my rhythm, my flow. This is basically how all my massages are. You're gonna find your own, just like everyone has a fight style, everyone has their own flow style for how they massage. So not that you're gonna fight when you're in a massage, but it's similar. It's just like you like snowboard, have your own style and your rhythm, or ski or whatever, or your own running pace and style. And we're basically repeating the same. So we're just adding some more time to the area of her tight flexor tendons, because she has been getting ulnar compression symptoms. Ulnar nerve compression symptoms. The ulnar nerve can be compressed at the inside elbow, the same side of the pinky, right at the elbow, where it exits around the olecranon process of the ulna, and that travels down the inside of the hand on the pinky side towards the pinky through the carpals, which is the hook of the hamate, where you can get the tunnel of Guyon syndrome, and you can also get claw hand. You can also have something similar to the where the pinky and the ring finger, they're curled up and they don't move because it's pinched off after so long. It can't move, and you need a medical intervention, or you just need to get more massages depending on how long it's been. If the nerve is pinched off, you would have to get an electromyogram and a nerve velocity conduction test to make sure that nothing more serious is happening if they don't have improvement with massage in the peripheral nerves. And if you go to a neurologist, you probably, especially that's what they do, they're going to want to operate on you because that's what they're trying to do. But not everyone can handle an operation or surgery, so this is called conservative care. Because in a surgery, it doesn't matter if you are getting your wisdom teeth pulled out in anesthesia or you're getting your heart replaced in anesthesia. Your body still feels it, and you still have catecholamines, which is norepinephrine and epinephrine. Norepinephrine and epinephrine are what trigger our nerves to respond, but norepinephrine is only specific to the sympathetic nervous system. Well, actually, acetylcholine is also another name for epinephrine. And so those have receptor sites in the heart and the aorta as well, in the brainstem, where it monitors the chemoreceptors, baroreceptors for pressure, and then also there's hormones, which is the chemoreceptors in the brainstem. And you also have respiration rate and heart rate in the brainstem. So anyhow, if you are on anesthesia, you could potentially die from just having a routine wisdom tooth pulled out, or if you have a heart complication, if it's too much for your brain to process and your heart's just rapidly going, maybe you had an underlying condition that wasn't caught before the surgery, or they just figured they just skipped that part. Some people do have heart attacks. Yeah, even in something like a knee replacement surgery, people have had heart attacks. Which, you have to be healthy to be under. So a lot of people would like to avoid surgery. And conservative care is a good way to see if you can heal first with conservative care before deciding to go and get treatment. And Chiropractic can actually help a lot of people too that have bulging discs, or they have postural changes. But so can massage with postural changes too, with stretching exercises, active range of motion, muscle contraction, muscle strengthening, massage, diet, nutrition, sleep, de-stress, vitamin D, sunlight, 15 minutes a day if they're healthy. Limit your intake of drinks, stay hydrated. And probiotics, of course, healthy gut. It is part of the enteric nervous system. In a 2-hour massage, you can do an abdomen massage and stimulate gut motility, stimulate the neurovascular bundles, nerve plexuses inside the gut, inferior, superior, mesenteric, and the pelvic sphincter nerves. And those are going to stimulate circulation to the gut to help get the little gut microbiota going, where you get your vitamin D, calcium for the blood, calcium your nerves rely on, your muscles rely on. You need calcium for everything, along with the other electrolytes like magnesium, phosphorus, sodium. Of course, you definitely need sodium. Sodium potassium pump in the muscle contraction. Calcium as well for preventing tetany, muscle spasm. When you don't have enough calcium in the blood, your muscle can't relax, and it just keeps contracting, trying to close that firing gate. And that could be due to a parathyroid hormone dysfunction. It could be like just not having enough calcium in your body. It can be other underlying conditions as well, because certain electrolytes, whenever you're sick, trying to balance the potassium and sodium levels in your body along with hydrogen, you can get into states of metabolic and respiratory alkalosis and acidosis, especially diabetics that aren't processing insulin and they have high glucose in their body, but their cells say they're starving, so their body starts making ketone bodies, and that can actually be very toxic to the body. And that toxicity from those ketone bodies can kill a person and put them in metabolic acidosis. And that's the way that you can have irregularities in other electrolytes like calcium and potassium. So in the cell, we have the sodium potassium pump, 3 sodium out, 2 potassium in. If you have high potassium in your blood, it means it's leaked out. You have tissue damage in the cells. Sodium exits with chloride, so you're gonna have chloride levels, same as sodium in the body. They run together. Hydrogen and calcium, when you enter those states, calcium depletes in the blood because it takes the receptor sites that hydrogen left as you start hyperventilating to accommodate the electrolytes and breathe off more hydrogen, so then you can get less acidosis in the body, because the more hydrogen you have, it means you're in an acidosis state. You want less in your body, so that's what it does. It breathes it out or poops it out for diarrhea, and that also eliminates a lot of potassium as well. So you have to have a lot of electrolyte balances. I learned this because I was 3 years in medical school, and this is part of physiology of the body, the cellular metabolism, biochemistry, also nutrition, anatomy, functional anatomy, general anatomy, functional anatomy, physiotherapy, and so on. And you'll see that I have these simple moves, but 2-hour massage, you have plenty of time to find those areas and work on them. If you know your patient, or your client actually, has areas that need more work, then you wouldn't spend as much time on the back, and you would go to that area. We know that her right knee has been bothering her, and we still have plenty of time left. It's only been like 40 minutes, so she still has an hour and 20 minutes. And this is a really good way to relax the nervous system, and some people might need more time to enter that restful parasympathetic response. And you know it's a parasympathetic response because if they were stressed out to begin with, they might have to pee during the massage. That just means they're relaxed, they're no longer stressed, and their bladder, the detrusor, and the ureter sphincter, the external ureter sphincter, they actually relax and open, and it means that, well, actually the bladder, the detrusor muscle contracts in a parasympathetic state to release urine, and the ureter relaxes to open to let out the urine in the parasympathetic state. But I mean, you don't want your client to pee, during the massage. But some people that work out right before a massage, I don't recommend it because you have to drink a lot of water when you're working out to get your metabolism going and to prevent a stroke. All their body holds on to all that water, like I'm just saying because I do. And when you get a massage or you're relaxed, all of a sudden your body is storing that water. It's going in your body and you have to pee. But because you can't pee, your bladder is relaxed, holding all the water, and your ureter sphincter is tightly constricted so you don't pee. Also, parasympathetic restful state responses are bronchoconstriction, so you don't breathe as much, a lowered heart rate, the rest and digest state. Blood goes from the skeletal muscle to the organs for digestion. And then vasodilation, so you're getting more circulation as well. Even though blood's going to the organs to digest, it's still just regularly maintaining the skeletal muscle, just not as much in the sympathetic state of stress, which is the fight, flight, or fright, which is freeze and repeat. That's like all this sympathetic response. And then parasympathetic, it's just rest and digest toxins microcellularly. Just keep working along the paraspinal muscles. You never want to dig directly over the spine, but the spine does have ligaments holding it. The interspinous processes, the interspinous ligaments, and then the intertransversus ligaments, and it's got the other ligaments along the vertebrae that you can't reach that are supporting the spinal column, like the posterior longitudinal ligament and anterior longitudinal ligament, which line the anterior and posterior area of the spinal canal, has the spinal cord. Spinal cord, interesting enough, ends right at the thoracic lumbar region, up to L2 at the furthest. If it goes further than that, that usually means they have a brain hemorrhage, and or a tethered cord. And then below L2, as a maximum distance from the brain, the cord no longer is a cord. It actually is just little nerve roots. So then you start having the inner nerve roots, so from L2, and then you got L3, L4, L5, S1, and they call it the cauda equina for a horse's tail. If you have a lesion on anything lower than L2, it's no longer called an upper motor nerve lesion, because it's now called a lower motor nerve lesion, because it is no longer connected to the cord or the brain. It's part of the peripheral nervous system. Interesting facts. And an upper motor nerve lesion will have spastic reflexes they can't control, or hypertonicity, hypertonicity, spasticity. Lower motor nerve lesion is a lesion that happens in the periphery that doesn't get to the brain. And so you can have nerve damage that can cause atrophy of muscle and loss of function. And before that happens, it can have sharp shooting pain, numbness, tingling, just like any pain pattern of a nerve. Paresthesia as well. And that will have hypotonicity, which means a loss of immediate reflex in the muscle will be weaker on that side. It can happen bilaterally, but that's usually what you're having to do with damage compressing the nerves at the spine directly, or it could be the central canal, stenosing the nerve roots as they exit the spinal canal. Usually it's unilaterally below LCA. I mean, anywhere is fine. It's unilaterally unless you have a cold damage or canal damage. There's many factors that can go into any pathology, but generally. And here we're just doing some knuckle stripping with our fists to kind of seal into the back and spine. I'm just seeing if there's anything else to work out on the body. That's like a bilateral knuckle stripping cross fiber along the rhomboids and the scapula and down along the erector spinae muscles, and the traps, upper traps, and you get to like occipitals. I guess pinch around the upper traps and the erector spinae of the neck. Lightly, of course, to handle it. Just for relaxation, get some. You can feel like where the upper traps and the scalenes are. So you're just running your fingers along the top underside of the upper traps underneath the scalenes when you're pinching lightly. See if there's any knots in there that you can like stretch out, or take your thumbs back pads into your thumb strip. Right here, found a few knots, so we're just taking lightly down stripping our fat pads along the levator scapula and the rhomboids. Upper traps as well, cross fibering and erector spinae, moving along the muscle fibers of the rhomboids and the levator scapula and upper traps. Continuing this process. You can do 3 to 4 per section, each little tiny strip, each little path the thumb makes. You don't want to really just do it consistently, like more than 4 times on one little thumb strip path, because it can be kind of annoying. It can be irritating unless they have an actual lesion there that you can actually feel getting pulled apart that direction. It can be annoying. It almost feels like you're plugging into the applications process and you're no longer enjoying the massage if you're the client, and it feels like you're in their brain and you're like listening to their thoughts, and their thoughts are saying they don't know what they're doing and they're doing that on you. So just do like 3 to 4 at the most on each thumb strip width. The width of your thumb, a strip all along the muscle fibers. You can go along the muscle fibers, either attachment to either attachment, insertion to origin to insertion. You can go cross fiber against the muscle fibers. Each of these muscle fibers, especially if it's the erector spinae, they're basically like a rope. It's basically little segments attached to each of the transverse processes and some of the ribs, supporting the spine, anchoring the spine, so that when they all contract as a unit, they extend back. Strengthening those is really good if somebody has poor posture. But you don't want to really strengthen those more if they have a lordotic curve. You want to lengthen them in the lower back, and you want to strengthen their abs to support it. And also if they have facet syndrome. Facet syndrome means the back elements of your spine from some other trauma like sports, gymnast hyperextension, has actually caused little fractures and possibly a full-on fracture of the pars interarticularis, or it can also cause arthritis or hypertrophy of the facets, which are the little cave bony structures on the outside of each vertebral segment where the nerve root exits from the spinal canal. And whenever you have hypertrophy right there, it's like an osteophyte. It's just arthritis, bony arthritis, and it pinches a nerve. And certain body movements, when that happens, if it's a dull aching pain, and it's just no longer, kind of like how an old pipe erodes, nickel erosion, but with bone. The material coming out of it is going to be compressed and tightened, and so what happens is over time, the local muscle fibers and nerve sensory fibers that are entering that nerve right from the tissue, they tend to feel the pain, but they can't localize it. They can't pinpoint it, so it's just like a dull pain, and that's a muscle pain that is helped with massage. And in those cases, hyperextension would not be good. So strengthening the lower postural muscles of rectus spinae, the QLs, would not be a good idea because it would just shorten those muscles even more and compress those bony structures even more and cause local pain. So what you want to do is you actually want to get them into mobilizing those joints so that they can eat up those bony areas and bring muscle cartilage to the ligaments supporting those segments and the muscle, so that you can create, with distraction, decompression of the nerve roots, compensation of the body so that it can support the spinal column without crushing the nerves due to the osteophytes or hypertrophy or arthritis. When you process this, you have to strengthen your abs, and you want to prevent, and you want to lengthen those lower back postural muscles, but you also want to prevent hyperextension. And until that happens, it can be like 3 months on average. So you would mobilize, go to a chiropractor and get adjustments. You would get your massages from me or other skilled massage therapists, and then you would do your exercises for ab strengthening. And we ended up spending more time on the back because we found more areas of the back that would work. Still got a little bit of circulation going on. We're not using anything more than medium pressure. If we wanted to dig deeply into her back, we just put more body weight into our thumb fat pad and glide that down those dense muscles. Her muscles aren't really that dense right there, so, and she doesn't have that much tension. She's only 20 years old, so you usually get that in people that have been really working, stuck in a position for a while and not really taking care of themselves as best as they should have been. And now we are gonna go ahead and we're working into the psoas. We're just overlaying our hands, flat fingers, and your fat pads to dig the soft tissue into the spine so we can reach the psoas. And we're doing that right there as well. Just do like 3 or 4 deep strokes because you can get the psoas that way. And then superficial with the effleurage, cross fiber against the rectus spinae. And then superior to inferior, just relaxing bilaterally, effleurage, finger fat pad of the thumb, stripping, knuckle stripping as well, along the paraspinal muscles, the broader contact as well, along the outer rib layers of soft tissue, which is the trapezius and the lats, superior to inferior, over the upper traps, levator scapulae, and then we're going right back to the scalene under the upper traps, along the levator scapulae and the rhomboids minor. Just a pinching fat pad, finger, thumb. Squeeze the muscles bilaterally along the upper back and neck region. Then unilateral effleurage towards the neck, and then unilateral scalenes and upper traps. Your finger pads are reaching under the upper traps into the skin, scanning for knots and adhesion lesions to relaxing the knots. Moving along the spine into the shoulder, tracing the medial edge of the scapula, having the client's hand on lower back. This helps lift the scapula. Work under the scapula to get the subscapular muscle and all that myofascial where it connects every muscle. Every muscle has to move along that myofascial. You don't want micro tears in that myofascial. It adds the tension and more adhesion lesion knot. So that's a good way to get into the rotator cuff muscles. Internal and external rotation, moving up along the back, down, superior to inferior, up again, around the shoulders, upper back, effleurage, lightly, ending, signaling that the back massage is coming to an end, or we can continue and What you're doing is you're doing small little circles with your fat pads of your fingers, and you're bringing the neck soft tissue up to the occipitals, which are right under the cranium. And this can be relaxing because it helps relieve that broad muscle band that is the frontal occipital muscle, which lies under the scalp, which overlays the dura mater under the cranium. And then the hair follicles, they're all relaxed. There's so much sensory in there that it helps stimulate cerebrospinal fluid as well. You can dig your thumbs into the scalp as well as acupressure trigger points in a way so that it can release pressure, but not too hard. And now I'm doing the thumb stripping down the back, and then we end the massage with a light stretch of the occipitals before covering the back of the client. And now we're onto the leg, draping the leg modestly with Princess, our pet, on the table. Just tuck the linens under the knee. You don't have to lift the leg or the foot up really. And then you can just pull the draping of the linen up so that it exposes more thigh. And you can work on the skin that is exposed on the thigh using the lotion. And we're effleuraging to distribute the lotion across the leg from the ankle to the thigh. We're not gonna massage into the actual popliteal fossa of the knee. We're also massaging the foot, the heel, and then the plantar and up again to the thigh, just to distribute the lotion onto the client's leg that we're going to be working into. So now we're using some thumb stripping and knuckle stripping, a little bit of kneading into the hamstrings, getting a little of the biceps femoris right here of the lateral hamstring, knuckle stripping. And you're going to do that 3 to 12 strokes when it's knuckle stripping because it's a broader area, but not the same strip worked. And now we're doing the thumb stripping, and from the knee to the hip as close as you can, while only massaging the skin that is exposed. And that is into the trochanteric band. That's where all the external hip rotators are. And that can relieve pressure off the sciatic nerve that travels down the thigh under the gluteal muscles and tendons. And we're doing thumb stripping along the medial and lateral hamstring right there. More laterally right there. That is the biceps femoris of the hamstring, and into the IT band and the external hip rotator attachment sites at the greater trochanter. We continue with this pattern of massaging the lateral thigh, and we massage some of the medial thigh where some of the adductors, semitendinosus, semimembranosus, gracilis can be, but we're sticking more to the lateral side because massaging too much on the medial thigh is kind of in a touchy area, so you don't want to get too close unless they really have some problems there. But you can massage it because you do want to massage as much soft tissue as possible to get circulation going. And we use our finger fat pads, our thumb knuckles, fat pads of our thumbs for thumb stripping of the deeper tissues in the thigh. The thigh has deeper tissue layers, thicker muscles. You can work a lot deeper into the thigh muscles. Some of them are tight when they have been in sports, like sprinting, football, even gymnastics or softball, weightlifting, powerlifting, all sorts of exercising that will work out those hamstrings that can become tight and built up. It's good to get blood flow circulating, especially if they have sciatic pain referral patterns. The sciatic nerve, if you feel symptoms traveling down to the knee and not past the knee, it could be sciatic symptoms related to a tight piriformis muscle, which is an external hip rotator, one of the external hip rotators of the gluteal muscles that gets tight when people are sitting for long periods of time. It gets shortened, and that shortened muscle needs to be stretched out. There are stretches to do for it, but you can also do massaging of the soft tissue to stimulate circulation and the nerve regrowth within the area so that the muscle can heal itself and be better able to pick up sensory. We continue with the thumb fat patch stripping. We're going to spend about 5 to 10 minutes on the thigh and the calf of each leg when it's a 2-hour massage. Could be even, a little bit more depending on what their issue is. The right knee is this client's issue though, and we're on the left leg. But you can spend the same time on both legs because the massage is going to help either way. And if you feel a resistance in the tissue, then you should spend more time on that area so you can lighten the tension, and that will help promote circulation as you have the lymphatics and the veins and the arteries and just regular muscle supply and myofascial that goes through the leg. Never massage behind the knee or in that popliteal fossa. You can massage up to it, but it is a sensitive area. There's neurovasculature in there as it passes to go to the calf from the thigh and up also from the calf to the thigh. So if we're talking about the veins and lymphatics, so that can be an area where fluid builds up, like synovial fluid. We're massaging with our thumb fat pads, doing thumb stripping, and we're massaging along the lateral gastrocnemius. That is an area where the peroneal longus also can be located, and peroneus brevis. They can also be called fibularis longus, fibularis brevis. The common peroneal nerve, common fibular nerve, passes right at the top of that lateral gastroc area, and it supplies the lower lateral leg and foot. And then we're finger fat patch stripping. We're just doing this in the same rhythm, 3 to 12 strokes per strip of soft tissue, digging deeper, adding more pressure as we get into more dense tissue. Locally under the thumbs, you can use your fingers to guide you, the finger fat pads to keep it in line. You can also just use the fists, knuckles of the fists. If you needed really deep tissue, you could dig your forearm by your elbow into the tissue and drag it up, but be careful. If there is pain right in this area right there in the bulkiest part of the calf when you're digging deep, it could mean they have a deep vein thrombosis. Usually there will be signs of it though, because as the venous blood slows down on its way up, the arterial blood that's much warmer and red will pool at the bottom, and there will be a heated red discoloration to the tissue that's already there before applying massage. Plus there will be pain, and maybe they have lack of movement, a little bit of loss of function. That is a life-threatening emergency. You can massage the person locally if they are on blood, not locally, but like outside of that region. But you definitely want to send them to the urgent care or emergency to get that looked at, because many people have deep vein thrombosis whenever they're coming out of surgery and bedridden for a few days, didn't get up to move, or if they're on a long flight, not moving, or if they've had surgery and went on a long flight and didn't move. Even in a healthy person, like that was something that happened to a famous tennis player. I guess she was going to Paris. She had to go back to LA to get it fixed, corrected. And if they're on blood thinners, that can make the skin weak, but it also will help to prevent the blood clot from forming again, or not really forming again, but getting worse. It doesn't dissolve the blood clot though, it just prevents it from getting worse. Some cases it does dissolve it just because of time and eating up the dead tissue, and macrophages can go in there and pull it out. But they might have to have surgery. So we continue with now we're doing the knuckle stripping along the lateral gastrocnemius head. You can work into the medial gastrocnemius like here and the middle. You can do the patrissage kneading with your finger and thumb fat pads, and you're just pulling up and away from the bone as you press into the muscle tissue rhythmically so that it's soothing. Checking for knots or tension or tight band or any changes in soft tissue texture in that area compared to the others, and you're going to work more on that with time, pressure, and different strokes if needed, going cross fiber against the fiber direction or along the fiber direction. And we keep this up. We're going to keep doing this for about another minute or two. We're continuing with the thumb fat pad stripping along the gastrocnemius, and we're doing the kneading patrissage with our finger fat pads and thumbs, squeezing the gastrocnemius heads together along the tendinous band up to below the popliteal fascia. We're doing the knuckle stripping. Now we're going back to the thigh. We're doing knuckle stripping along the lateral hamstring, medial hamstring, and we're into the biceps femoris right there, a little bit of the IT band. We're going to go ahead and massage some of the foot. We're going to use FLR around the foot, then we're digging we're massaging the toes, and then we're digging thumb stripping down from the heel to the toes into the plantar fascia. This can be relaxing as it massages a broad band that connects from the calcaneus to the metatarsal heads. And we keep with the thumb stripping along the plantar fascia, relieving tension. If it's very tight, it's a little tight in there. We're going on the medial plantar fascia right there. And we keep going, thumb stripping. You can go a little bit smaller with the strokes after you do the longer strokes that are more soothing, just to break up any lesions or palpate for knots, any adhesion lesion knots. And we continue. Now we're doing circular FRH type strokes, a little bit of thumb stripping into the balls of the feet, which is where the metatarsal heads are. And then thumb stripping again along the plantar of the foot from heel to toes, relaxing. We're doing like 10 to 20 of those FRH strokes, not all in the same spot, moving around from medial to lateral. You can turn your body and push the plantar fascia with thumb stripping from heels to toes, heels to balls of feet. And we got the plantar fascia. It's starting to lighten up the tension. This client used to be ticklish, but not anymore. This is very soothing and relaxing. And so now we're doing knuckle stripping. We're just holding the foot in place right around the malleolus while we knuckle strip from the heel to the balls of the feet. And now we're doing the circular effleurage of the balls of the feet while holding the foot up slightly. And we're doing more thumb stripping on the plantar fascia from the heel to the balls of the feet. Keep doing this, not in the same strip. And now we're going up to the calf. We're just kneading the gastrocnemius, the meaty part of the calf, picking up the meaty tissue off the bones of the tibia and fibula, running that together, effleurage up, thumb stripping along the gastrocnemius of the calf, right below the popliteal fossa. And we're going back to the calf for more kneading. We're mixing up our styles but keeping it consistent, alternating between this kneading and pushing the heads of the gastroc together, thumb stripping up to below the popliteal fossa from the tendinous attachment to the Achilles of the gastrocnemius. And we're just going to continue lightly thumb stripping or deeper thumb stripping as we get into the deeper dense tissue. And then we're going to also continue to knead and look for any other knots and adhesions, tensions, changes in soft tissue, so that we can spend more time if we didn't find it earlier. This is very soothing and relaxing. If not, adjust your pressure, change time, avoid the area. If there's pain, that's not normal, so see if there is the discoloration on the red and heat in the lower leg. It could indicate a deep vein thrombosis, and avoid that area, and then refer them out to an urgent or emergent care. Slowly now we're covering up that leg and repositioning so that we get external hip rotation. This is a great way to flex the knee and put the foot elevated on a bolster while you tuck the sheet into the top of the thigh and work into the iliotibial band, the IT band. We're doing athlage. We're picking up the soft tissue between the lateral quads and lateral hamstring by the iliotibial band and taking it off the femoral lightly as we push those tissues together in a kneading sort of way with our finger fat pads. Now we're doing the thumb stripping lightly along the IT band. You're not digging deep. It is a dense tissue, but it's sensitive. So you're just lightly working in the pressure, and then you can add more pressure if there is no reaction to that pressure, and if you want to see more resistance or tension or reaction, that indicates there could be something going on there. And so now we're doing the vastus hamstring. It's in a shortened position. It's relaxed, it's not contracting, so we can get in between the muscle fibers to push out any excess waste products from micromolecules, degradation, microfibers, push it into the lymphatics, the venous system, right along the myofascial, continue thumb stripping, right above the knee, not into the palpated facet. You can just lightly dig deeper because it's going to be softer. It's in a shortened position for the hamstring and a lengthened position for the quadriceps. Iliotibial band connects from the tensor fasciae latae at the top of the hip down past the knee onto the gluteus tubercle of the tibia. And you're going to keep, now we're doing knuckle stripping and thumb stripping along at an oblique direction across the hamstring and the iliotibial band. You can go obliquely along the grain, across the grain with kneading or petrissage. You can do along efferage, thumb stripping, knuckle stripping, palm stripping, flat finger fat pad stripping, but don't go under the covers. Just go right at the covers. And the tissue will push you where it looks like it might go under the covers, but it's not. It's just the tissue soft because it's in the shortened state, except for the front right there. That is a lengthened, tighter state because the quad is stretched in that knee flex position. And you're going to keep repeating this. It's a soothing effect. It also brings circulation, stimulation, healing, and it's going to stimulate those muscles that might not have been getting enough of circulation, nerve conduction. It's going to relieve excess peripheral nerve compression off the sciatic and femoral nerve that pass through the front for the femoral nerve and the back for the sciatic nerve of the thigh, along with soft tissues of the thigh wrapping around the femur bone. We're going to continue, and now we can shorten to localize any adhesions and pull them apart lightly with thumb stripping as we find tension, or if we find a knot, or we find resistance in the soft tissue there that's different from the adjacent soft tissue. That helps to alleviate any peripheral nerve compression in the thigh that is caused by tight soft tissue or knotted up soft tissue. Now we're just picking up lightly the iliotibial band and getting underneath the iliotibial band by the hamstring by lifting up the soft tissue with our fingers and thumbs, fat pads, and then lightly kneading it, pushing it together to stimulate circulation and break apart any adhesions, also scanning for any knots that we can work into. Palpating for tenderness all along the time as we move from superficial to deeper tissue layers. of the thigh. Now we're doing a flat finger pad, palm, FLR, just to trace the muscle fibers and see if there is any resistance at that level, a superficial level, or as we go deeper, if there's any sensitivity to tenderness, to touch, pressure. As we move deeper into the iliotibial band, getting under the bottom of the hamstring, right above the popliteal fossa, but not digging into the popliteal fossa. Our rhythmic flow, and now we're onto the calf. We're getting that gastrocnemius, pulling it away from the popliteal fossa obliquely along the fibula and tibia right there, the lateral gastrocnemius, and we're massaging the lateral gastrocnemius, but we're also in the neighborhood of the peroneus longus brevis and the anterior tibialis. That's a good way to get into the anterior tibialis. You can also use this type of leg movement in a longer massage, or if they don't want to be face up for whatever reason and you're not able to massage the front of the thighs or leg, you can get most of the movement parts with this leg and hip and reflection. And we're kneading the gastrocnemius muscle off the tibia and femur bone lightly with your finger fat pads and thumb pads, just pulling it lightly away from the attachment along the tibia, going into the tendon of the Achilles, working up to the popliteal fossa, but not into it. And we're doing this because it's rhythmic and it enables the gauge and the cohesion and the lateral collarbone. The calf that may be missed whenever we add the leg straightened, extended up there earlier. We're going to keep doing this. The finger fat pads, going fat pad, kneading. Now we're doing the FLRs, finger fat pads from the Achilles attachment to the popliteal fossa of the knee, along the gastrocnemius, lateral head, peroneus longus, thumb stripping, peroneus brevis, and the gastrocnemius. Alternating between flat finger fat pad, FLRs, kneading, and then thumb stripping fat pads. This is a seating rhythmic effect. And I'm trying to spend more time getting closer to superficial areas where knots or tension or resistance in the soft tissue can be. We discovered there's not really too much going on there, so we can extend the hip and the knee, and now we're done with the leg. We're going to go ahead and move on to the other leg now. We're doing some light compressions over the linen too. It helps absorb some of the lubricant off the skin. Like the oil has a little oily surface on it. And then we're also just compressing the layers so that we don't just drop the leg off and go on to the next one. It's a little bit added soothing effect to the leg. Now we're just draping the other leg. This is the right leg where our client has right knee discomfort. That's new. It's a new change. And so we're going to work on this leg. We might spend more time on it, but we did spend a good amount of time on the other leg as well as this leg. And the massage will help with the healing process, because the healing process is going to go at the rate of each client. And she's a healthy 20-year-old female. So now we've already tucked, we've draped, we've secured the linen in place. We're just double securing it right there. Don't want to go under the draping when you massage. You can go up to the draping, but that's it. And so we're effleuraging by distributing the lotion. We're using lotion. It has an oily consistency on it, so it's great for massage. It's a special massage lotion. You can get it online, hypoallergenic. And so we're distributing the lotion across the calves, the thighs, making sure that every skin surface is covered with lotion, because it can be abrasive and irritating if not. And we're starting off after the effleurage with our knuckle stripping, gauging for any tension, changes in tissue. We're just also pulling that hamstring muscle around from its insertion up to its origin towards the heart. That's not a key factor though, going towards the heart. I mean, it is good because of the veins, they go towards the heart, and the lymphatics go towards the heart, but they all move together, and the arteries are actually going down towards the feet. So we just move along the grain of the muscle, and pushing the muscle fibers will actually just squeeze all that fluid into the vein that's already deep to the muscle going up towards the heart. And I mean, if you want to go the other way, sure you can, but it is actually just more fluid to go when you're on the legs and the arms, extremities, to move towards the heart. But the back, you can go either direction, it doesn't really matter. And then the legs as well, it's just a little awkward if you go the other direction, because then it's pushing it into the joints of the knees, and the knee is a sensitive area where fluid can build up, so we want to pull fluid away from the knee. We're thumb stripping, we're knuckle stripping, thumb stripping, we're mixing it up. This distributes pressure across a broader area with a little deeper focus on where the thumb fat pads are. And we're stripping each little fiber. We're into the iliotibial band, biceps foris of the lateral head of the hamstring muscle, into the medial hamstring right here, a little bit into the semitendinosus, semimembranosus, into a little bit of the adductors, a little bit more than the other side. We're spending more time on some of these muscles because they're all pulling on the knee, and she has complaints of a right knee ache that's new. So we're getting more into the upper muscles right here to pull at the tendinous band, attaching to the various placements along the knee joint, which all of these attach and pass on the other side of the knee onto the tibia. So the biceps foris, iliotibial band, the semitendinosus, semimembranosus, gastroc, all attached to the tibia that's on the other side of the knee joint. The adductors attached to the femur from the pelvic pubic bone, actually, and ilium. So here we go. We're thumb stripping with our finger fat pads, lightly at first, seeing if there's any resistance, any changes, any tissue changes in resistance under your pressure as you glide along the soft tissues of the thigh, moving from the popliteal fossa to the attachment along the greater trochanteric region of the femur, where all the external hip rotators of the gluteus tendinous muscles attach, including the piriformis muscle, which can get shortened and tight whenever sitting for prolonged times. We're into the greater trochanteric area where the gluteal and the thigh meet right there. That's the piriformis can be released. The other external gluteal hip rotators like the gluteal maximus, medius, the superior and inferior gemellus, obturator internus. So keep massaging in there. And you can move up to the boundary line of the linens to massage the hamstring so it secures the client's comfort. And you're going to keep doing this knuckle stripping now to get a broader area to disperse all the tissue waste around, improve circulation. Now we're going into the gastrocnemius, scanning for tension changes around the knee, palpated fossa. The lateral gastrocnemius head, the medial, we're kneading with our finger fat pads and thumb fat pads, pulling the tissue up off the tibia and femoral bone of the calf. And we're gently using a flat finger pad and thumb fat pad stripping of the gastroc. And then we're going to keep thumb stripping now of the gastrocnemius of the calf. Down the center, right in between the two heads of the medial and lateral gastrocnemius. The gastrocnemius are the superficial, deep, soft, dense tissue, muscle tissue of the calf. And they are responsible for knee stabilizing and knee extension, but mostly for knee flexion, assisting the knee in place into their condyle, hyaline lined menisci attachments to the femoral condyles along the tibial plateau. We're going to keep finger fat pad stripping, thumb stripping. So thumb stripping along the medial head, moving towards the lateral head of the gastrocnemius from the Achilles attachment That's a long tendinous band onto the calcaneus where the Achilles attaches. Moving up just below the popliteal fossa, the gastrocnemius heads attach on the outer surfaces of the popliteal fossa to the femoral deep under those tissues. And so we continue thumb stripping the calf muscle, the lateral gastrocnemius now. And we're going to continue with that. Now we're kneading. We're pulling up the gastrocnemius off of the tibia and fibula. Just getting some fluid going on, distributing circulation, getting the lymphatics moving, the venous blood flow traveling, pulling up any adhesions, some tight muscle tissue, just pulling the myofascial part. We're now knuckle stripping along the lateral head of the gastrocnemius into the gastrocnemius, between the two heads, up to the thigh. Now we're pulling the hamstring muscle with our knuckle stripping from the popliteal fossa, above the popliteal fossa, to the upper thigh below the trochanters, ischial tuberosities, and the trochanter of the femur. And so we're going back to the calf, pulling that gastrocnemius off the tibia, relaxing with the kneading of the finger and thumb fat pads while you're massaging the heads of the gastrocnemius. This is very soothing. It also allows nerve stimulation for the supplies of the lateral and medial by the division split of the sciatic nerve into the common peroneal nerve and the tibial nerve, so that you can get good blood flow going to those nerves too, so they can conduct better. And you're getting, now we're doing the knuckle stripping of the calf muscle from Achilles to below the popliteal fossa, just above the Achilles to the popliteal fossa, along all that soft tissue right there, digging deeper but flattening out the muscle bands, moving with the direction of the muscle fibers. When we're kneading, we're moving across the muscle fiber direction to pull it up off the bone gently. Now we're into the foot. We're massaging the balls of the feet and the toes gently. Circular motions, effleurage with our thumb fat pads. This is where the metatarsal heads meet the phalanges, and now we're going to thumb strip from heel to balls of feet on the plantar fascia, loosening up that plantar muscle that can become thick and tighten and cramp up in people. And so we're just continuing to thumb strip from the calcaneus heel fat pad down along the plantar muscle to the metatarsal heads, where the balls of the feet are located, right into the arch of the foot. We're massaging, thumb stripping, continue to do that, 10 to 20 strokes. You can move direction and go the other way. This is nice and soothing as you allow more soft tissue to decompress with your massage, healing, so that you can take up any compression on the peripheral nerves that are supplying the feet and improve circulation and vascular changes. At this moment, you can also palpate for tenderness if they have gout or metabolic disease, if they were to have a podagra, or if they have sensitivities or a small fat pad, a bone spur. All of that can be soothing because it brings circulation in, and with certain diets, they do know that certain calcium buildup in the tendons can damage, but it can also be dissolved if you have a certain amount of supplements, like some B vitamins in there that can pull up the calcium, but movement also, because you'll get circulation in there. Surgery is also an option, but that's not conservative and that's not something we do. So we're going to continue with our thumb fat pad stripping of the plantar fascia. We're spending like 1 to 2 minutes on this. This is a 2-hour massage, so I mean, you could spend more time if you want. People do reflexology massage, which is an ancient Chinese, traditional Chinese, ancient Chinese therapeutic healing modality for a reflection of the body and its organs along placement locations geographically along the foot. You can get a reflexology map anywhere online for free, or buy it and put it on your wall as a poster. Now we're moving up to the gastrocnemius, the calf muscles, and we're using our knuckles to strip it, and now moving up above the popliteal to the thigh, stripping with our knuckles. And now we're going to adjust the draping, because we're going to now put our client's leg into hip and knee flexion so we can get the anterior and lateral soft tissue of the leg and the thigh. The leg is the calf and shin. For anatomy purposes, the leg is actually the lower leg, and the thigh is the upper leg. But we're redraping, and now we're going to be able to get better into the shortened state of the hamstring, which will be more movement, more areas to reach to push any waste toxin and stimulate circulation from the degraded muscle fibers and myofascial that we're working out adhesion lesions. We're also stimulating lymphatic flow and venous flow. You don't want them to flex their knee entirely, because you do want to get in there, but you don't want to hurt them either. And you don't want them to block off nerve and vasculature towards the body's heart, where it can be detoxed. And so we're thumb stripping lightly at first. The fingers are flat and just guiding the thumbs along, or we're also using the finger fat pads to gently effleurage into the soft tissue of the thigh. The iliotibial band, starting off light because it's more sensitive. Right here on the side of the biceps femoris and into the vastus lateralis of the quadriceps muscle, which is in the lengthened state. So it's tighter, and we're into that iliotibial band, always starting off lighter, moving a little bit more with our thumb and finger stripping with our fat pads. And doing an effleurage, you can dig your palms in there too. Just stretch that thigh muscle off the knee. It's going to bring some extra fluid with it that could be trapped in the knee or circulating around the knee, like the synovial fluid that surrounds each of the bursae and sacs of the knee to hydrate and bring fibrocartilage to the hyaline and the meniscofibrocartilage discs. This is our 20-year-old patient with right knee pain. So we're just working a little bit more into all of the muscles around the thigh that attach and cross the knee, as well as the calf. But right now we're on the thigh. We're on the iliotibial band, the distal quadriceps vastus lateralis, right by the rectus femoris, which crosses in the middle. Those are hip flexors. And the gastrocnemius is also in a shortened state, which is the calf muscle. And with the thumb stripping, after doing some circular effleurage, soft tissue across the distal thigh, we're moving up from the distal thigh to the proximal thigh, along the iliotibial band and the quadriceps vastus lateralis muscle belly, and into the hamstring, the lateral biceps femoris of the hamstring on the other side of the iliotibial band. Now we're going to pull tissue away from the knee on the calf, just lightly with our finger fat pads and kneading motion. Pulling lightly. And it is lotioned, wheeled up, so that it glides superficially without friction, which makes it more soothing. There's no stops in the tissue as it runs into the bone if you have lotion, and also you avoid burning the skin or causing friction burns on the skin when you use a lubricant like lotion or oil to do Swedish massage. If you're not into lotion or oil, they have myofascial trigger point release, stretching, PIR, post-isometric relaxation inhibition, so you can work into the muscle bellies with stretch and an active range of motion, resisted range of motion as well, to work out adhesion lesions. You don't need oily lotion for those ones. And also cross fiber friction on the tendon attachment and ligament attachments. We're not doing that in this video. We're just doing a Swedish 2-hour, and we're using medium pressure. And we're now kneading the gastroc lateral head off the tibia and fibula bone right there, bringing up circulation. We're pushing the muscle belly around after we pulled it off the knee joint. We're moving it up, to detox and move into the venous and lymphatics to be eliminated from that area of the body. Also scanning for knots. We're into the peroneus longus right here. It's right below, it's between the shin and then the fibular bone, and you can feel some of the tibia right there, the peroneus longus and the anterior tibialis. So you can get them. Those are responsible for dorsiflexion and inverting of the foot. And so we're going to continue thumb stripping along those muscle fibers. Never digging deep on the bone, but just onto the tissue that's attached to the bone. Because of the myofascial that's there that can hold adhesion lesions and tension that can pull on peripheral nerves. We don't want peripheral nerve compression, so our goal is to increase movement in the soft tissues around peripheral nerve location and to remove excess fluid buildup around joints or tension that's on joints, detect imbalances in the joint muscle soft tissue. The locus might be tighter than others and that can pull irregularly on the joint. They need to be uniform, using the same amount of force. The quads and the hamstring, they both act on the knee. They don't act on the knee at the same time. It's an inhibitory reflex arc, and that's how PIR and RI work in the muscle contraction. We're doing the effleurage of the thigh. We're bringing it back because the leg is now done. We didn't find anything, so now we're going to re-drape the leg after we do a little bit of effleurage just to make sure there's nothing else going one more time, plus to also pull knee fluid out and up into the venous and lymphatic system. We're going to do a little bit of circular thumb effleurage stripping, moving up along the biceps femoris, away from the knee, and then just palpating the knee for tenderness, going back into thumb stripping along the biceps femoris, above the iliotibial, or behind the iliotibial band, into it, digging a little deeper away from the knee, and then we're going into the calf, lateral head of the gastrocnemius, up to the popliteal fossa, moving fluid and waste products up in the calf into the deep venous and lymphatics to be eliminated. We're going to continue now. We're doing knuckle stripping. A little bit softer up to the thigh, passing the popliteal fossa. Never massage on the popliteal fossa. You can massage away from it or up to it. And now we're going to go ahead and re-drape the leg. We're re-draping the leg, and now we're getting ready to turn our client over. And so now we are just compressing, pulling the excess oil off the skin. Even though we're using lotion, it does leave a film because it's massage lotion. And then it also helps to relax those muscles before turning over. Notified to the client that we're going to be turning over. Now we're turning our client over. So to do this, I had to also extend the battery life with a portable USB battery, but we're going to go ahead and hold the covers and ask our client to turn over. So we're getting on the other side and just going to hold the covers above the client so she can turn over. You can take the bolster out as well so that it's easier. Make sure they don't turn over too fast. You're just covering their body to make sure they're not exposed. And then we lower the face cradle so that when we come to that time when they're already relaxed, we're not making extra noise to disturb them. From the relaxation state, I'm just placing the battery for the camera in my pocket, and now I'm going to go ahead and start to undrape this left leg and work on the supine client. We have to work around Princess, our pet dog, who is on the table accompanying our client. And so we do this gently. by taking the top cover, we're going to just make sure that it's fully covering the client on the top, and then on the bottom, walking around the table, moving the blanket around. And now we're going to go ahead and start at the ankle. We're going to remove the top cover first and then start with the ankle, and then just gently move Princess up out of the way and reposition her so that we can tuck the linen under the knee and pull up as high as we can on the thigh, and then roll the top drape under so that we have thigh exposed anteriorly to work on the quads. Now we're just doing effleurage with our lotion, our massage lotion. We're actually going to attempt to put Princess on a different surface next to the table, and we're doing knuckle stripping on the quadriceps, the lateral quadriceps, that's the vastus lateralis, and now the middle is the rectus femoris. Moving from above the knee to the top of the boundary line of the draping. Effleurage getting into the adductors of the thigh. More lotion, effleurage of the thigh. Soft tissues, adductors right there. Picking up the muscle lightly, the soft tissue off the bone. And then palpating at the same time while scanning for adhesion lesion knots between the myofascial and the layers of muscles right there. Medial is the vastus medialis obliquus, and the rectus femoris is right there, and then the lateral side is the vastus lateralis, head of the quadratus femoris muscle. And now we're doing our thumb stripping with our thumb fat pad and our knuckles lightly from top of the knee to the top of the boundary to the bottom of the boundary line of the draping, and some flat palm pressure as well, just readjusting the battery right there to the camera because it died in one instance and it wasn't working, so we're just going with one view now. And our client is patiently waiting. This wouldn't happen in a normal 2 hour, but we're limited by our tools. So we did get it working a little bit, so we have a second view right here. We're actually going with the audio camera. And so now we have placed the camera so that we can get a good enough view. And the video quality isn't as great, but we can see that we're thumb stripping, knuckle stripping along the vastus lateralis and the quadratus femoris. They are the same. It's just a part of the quadratus femoris. Above the knee to the top of the thigh, at the boundary line, thumb stripping, knuckle stripping, moving tissue away from the popliteal bone, the knee, and then thumb stripping along lightly and then deeper if needed. And we're massaging around the knee. We're just circling the knee, the patella, because there's plica bands and synovial fluid under, and it can get tight. And this also hydrates the patella tendon and the quadratus tendon that attach below and above the patella, so that it moves with the knee when it moves into extension and flexion. Now we're massaging the shin area right around the tibia bone into the anterior tibialis. And getting into the foot, which you can't see. We're just massaging with our finger fat pads on the plantar surface of the foot 10 to 20 times. Now we're moving up the calf to the thigh. We're going to go ahead and drape that because we don't need to spend that much time on it. And we're just compressing over those areas of the leg and the foot to absorb any excess lotion or oil. We're limited by our view here on the camera angles, but you can see a little bit with the one top view. We're redraping the leg, pulling the drape under the knee. You have to lift the leg up a tiny bit to do that. so you can secure the drape in place. And we're putting our lotion on the leg from the knee to the thigh, and then down the calf, the shin as well, and up to the thigh. We're just applying our lotion in effleurage type strokes, and now we're doing the flat finger pad effleurage strokes from the knee to the boundary line of the drape on the thigh. We're massaging over the quadratus femoris, vastus lateralis head, the rectus femoris head, and the vastus medialis head of the quadratus femoris. This is going to help as we pull soft tissue away from the knee, and we're pulling excess fluid into the venous system and the lymphatic system, as well as distributing arterial blood flow to the muscles and nerve fibers so you get better nerve conduction and muscle function. And we're going to continue with our effleurage strokes. We're doing the thumb stripping, knuckle stripping, repeating, and then we're doing kneading with our finger and fat pads, or with our knuckles if needed, if there's enough tissue. Keeping the same rhythm and flow as we massage the soft tissue of the thigh to pull up and scan for knotted up soft tissue, adhesion, lesion, knots. And we're doing the long strokes of the effleurage to pull it out, relax and soften the tissues to prevent peripheral nerve compression that could be around the femoral nerve. In this area, they could get something from femoral nerve impingement called neuralgia paresthetica, which is a numbing, tingling of the anterior thigh above the knee and medially. That happened a lot more in pregnant females as their belly gets bigger and their clothes get tighter around the groin area. It cuts off nerve supply to the femoral nerve. It supplies the front of the leg and foot and front of the thigh, mostly the front of the thigh. And so now we're working into the calf, and also tight jeans. Tight jeans caused neuralgia paresthetica back in the early 2000s when kids were wearing them. And so they stopped, and there was not as many cases. And so now we're doing the finger, fat pad, thumb, kneading. Now we're doing effleurage along the anterior tibialis, between the hard bone of the tibia, and from foot to below the knee. And now we're just massaging lightly around the kneecap to stimulate circulation and synovial fluid that circulates in the knee. And along the tibia, we're going to go ahead and start massaging as well. We're keeping our flow and rhythm moving along as we feel different textures in the tissue, changes from tension or compression or knotted up adhesion lesions. Also, if there's any cuts from shaving, avoiding those cuts as well. Always avoiding skin lesions. So anything contagious, the massage has to stop in that area, but can be focused more on the other area. That's why you have to have the lights on. It's really not a good idea to massage in the complete dark because you really expose yourself to picking up somebody if they have shingles or an open lesion or like warts or something. So you always want to make sure you're scanning and see that so you can avoid it, because they might not be aware of it, or they may have forgotten, or maybe they're embarrassed so they don't want to know. But this client doesn't have any of that, but we're just saying that's, some people do have the dark rooms, and it's great because they really show that they're humble and they want to be servants for their clients. But it's stupid because they can't see any skin any lesions that could be contagious or hurt the client. So really you want to be able to see the skin of your client so you don't injure them more or spread a communicable disease to other people as you touch doorknob surfaces and wash your hand and move in the room or whatever. So then we're done with that leg. We're going to cover it up, or we have already covered it up, and now we're moving to the arms. We're just modestly draping, securing at the armpit, lifting the arm, tucking and pulling the draping under the arm as we massage into the arm, distributing lotion from the forearm to the shoulder along the arm, flat palm pressure, finger fat pad, closed fingers along the surface of the upper arm, along the deltoid into the attachment of the pec minor as it crosses under the coracoid, crosses onto the and then we have the pec major that crosses onto the humerus. So we're getting those attachment sites. Many attachments onto the arm are in the upper arm. So now we're moving into the forearm, thumb stripping into those extensor bands and flexor bands of the forearm. Those can get really tight and knotted. You're using more pressure on the forearm than the upper arm because it can be more sensitive unless they have really tight developed shoulders. This client had some tight shoulders and pecs right along the shoulder, along the upper arm. So we could use a little bit more pressure on the upper arm, but not really so much on the biceps or triceps. So we're moving into the wrist and the hand. We're just going to use our finger fat pads, much like the foot, to get into the soft tissues of the palm of the hand, and then just spread the tissue around so they can distribute circulation and nerve flow. This right here is just our wrist motion. It's a good way to relax the quadratus tendon around the quadratus retinaculum tendon, which crosses the wrist at the distal ulnar radius, which can compress the median nerve. So doing that, it gives a little bit of movement and tests for range of motion as well as if you do it a certain way, you can test for clonus, which is an upper motor nerve lesion from a stroke or similar. And so now we're on the other arm. We've done the same draping of the arm to secure modesty, and we're working into the arm, the shoulders, and the forearms, flexor and extensor bands of the forearm. And we are digging with our thumb stripping with our thumb fat pads, stripping from the wrist to the forearm, to the elbow, not into the elbow, avoiding the cubital fossa of the elbow. And then we're just scanning for knots, tight tissue that can develop in the forearms. And we're going to do that like 3 to 20 strokes along the flexor bands and extensor bands of the hand, because those can get really tight in students and people who work with their hands a lot, mechanics as well, massage therapists too, anybody who works with their hands. And we're doing again the rotation of the wrist and extension flexion to loosen up that retinaculum band around the wrist at the distal ulnar radius. We've covered up the arm, and now we are adjusting the camera view so that we can go into the scalp and have a better view of our craniosacral massage, which helps to stimulate cerebrospinal fluid throughout the body, from the brain to the spinal canal, hydrating all the meningeal tissue so that we get good nerve conduction from the source. And it's relaxing as well as the cerebrospinal fluid moves through. Actually, before we do that, we're doing the abdominal massage. Typically, we wouldn't cover the abdomen, but we just put a pillow over the tissue because we just want to do this. We're not palpating. We're kind of palpating for any types of irregularities in the abdomen, which you can palpate for tenderness, pain. It can indicate by region what it is, anything from female reproductive pain like menstruation or fibroids or ectopic pregnancy or PCOS, polycystic ovarian syndrome, or we can have like bladder stones, kidney stone, referral pattern down the ureters, appendicitis, enlarged liver, enlarged spleen, enlarged gallbladder, cholecystitis for like stones in the gallbladder, constipation, diarrhea, IBD, pain, diverticulitis in people older than 50, which are like external polyps that grow outside of the colon that can rupture, usually in people that don't have enough fiber and have constipation. Over time, those grow, and they can cause internal bleeding, excess fluid ascites from liver disease or heart disease as well. It's going to be palpated with pain, tenderness, such as the stretched fibers of the peritoneum cavity of the abdomen is stretched. It sends off a lot of pain, especially to touch. When you have internal bleeding that stretches it. Now we're into the craniosacral. We only spent about 3 to 12 light circular movements on the abdomen, moving from appendix around to liver to spleen to sigmoid colon across the bladder, and then doing that in circular clockwise fashion. Now we have secured the draping under the arm so that we don't expose any breast tissue. So you do that by just securing the linen and top cover and having the client lift arms to pull the linens under. And when we get into the massage, we pull up from the upper traps along the neck up to the occipitals, and we gently cradle the head, and then we can work into the muscles. We're going to be able to work into the pecs and the scalenes. That is the pec major right there under the clavicle. Trying to avoid any breast tissue that falls from gravity onto the clavicle when someone has a large chest. That's why it's good to make sure the draping covers it and tucks the tissue. We're getting under the supraspinatus, under the shoulders, the upper back. We're getting into that levator scapular attachment on the scapula with our knuckles as we knuckle our forearm. And our thumb isn't really pressing in, but it's just there while we use our knuckles to knuckle strip on the upper traps, the scalenes. You can get into the posterior scalenes right here with your thumb stripping the posterior scalenes while you're also knuckle stripping the upper trapezius and levator scapular. I'm doing that 3 to 12 times per side. If it's too much tension or not enough, adjusting your pressure. Scanning for knots. You find little knots, you can spend more time moving across the knot so it breaks up those fibers so that it gives more room, and it prevents peripheral nerve compression, which can happen as the brachial plexus passes through the scalene under the clavicle and the first rib under the arm. So we're moving into the pec major under the clavicle and where the trapezius is, supraspinatus, also where the thumb is, and then we're just massaging the tops of the shoulder where the supraspinatus attaches, and then we're going back to the neck, and we're going to pull the soft tissue from the upper trapezius up along into the occipitals. Give it a nice stretch, a little bit of finger fat pad circulation that you can't see. The fingers are curled under the occipitals. It's a good way to loosen up that frontal occipital muscle sheath, as well as the attachments by the trapezius, and then also the scalenes on the occipital region of the cranium. And then we're going to start doing the scalp massage. We're going to go ahead and press lightly with our thumb fat pads into the skull right here, the scalp. Just light circular motions with a little bit of light acupressure as well, but not holding each spot, just circling each part of the scalp as we come across it. And with our fingers, we're doing light circle movements across the scalp as well. This is soothing. It stimulates electrical energy to the brain, which stimulates cerebral spinal fluid flow. It also loosens up the attachments along the cranium so that you can get more cerebral spinal flow from all the fluid that's moving along with the blood vasculature up and down the neck and the face. We're getting into the sinuses. Those are the maxillary sinuses right there. Right along the sides of the nose, above the lip, under the eyes, avoiding the eyes, of course, just light circular finger fat pad movements. And then now we're going to gently move the eye pillow up, and we're going to get into the brow, just lightly the brow. These are the maxillary sinuses. Just light finger fat pad, thumb fat pad stripping along the frontalis muscle of the face, and then across the brow line right there. And effleurage of the muscle tissue there. It's very relaxing. There's a lot of blood flow that goes in there, nervous flow. You have the trigeminal first division nerve for sensory, and then you also have the facial nerve for facial expression right there. Alright, so we're done with that. We've concluded our massage, and now we're going to check on the client to see how she's feeling.
Okay, so how's your knee?
It feels better.
Awesome.
There's less pressure on it.
Awesome. And then how's your back?
It feels better too.
Cool. Awesome. Thanks.